Hey, I'm John Butler. I'm excited that you're here today, and let's get right into this. I've been a veteran of the insurance industry for 28 years. I actually sold my brokerage firm in September of 2023 to go completely independent. I am the author of this book, Health Insurance Sucks, The Moral Case for Better Business Healthcare. And today, after 4 years of research and development, I'm proud to introduce to America something I call the Cafeteria Plan, a once-and-for-all fix to business healthcare. Now, I call this the Cafeteria Plan for a reason. I wanted my readers to understand, as well as my clients to understand this in the marketplace. The concept of a cafeteria plan is similar to a cafeteria restaurant. But the concept in the healthcare world is your boss is giving you so much money for your tray, and then you pick and choose your own plan in the marketplace using your boss's money, and then you get it and you own it and you control it. Now, this one is specifically for companies that are 49 employees or under. So keep that in mind as we go through this. So what I found out throughout my 4.5 years of research into this is that traditional health insurance is foundationally and fundamentally a flawed system. Why is that? Well, most businesses, when they buy a traditional plan, whether it's Blue Cross, Cigna, Aetna, United Healthcare, whatever that might be, they actually own the insurance. They buy it and they own it. And then they probably give their employees different deductible choices in the marketplace. They set an amount that they're going to provide for their employees, and then their employees pay the rest, whether they're singles with kids or families. That's most people understand that. But 90% of America is set up this way. So if we're going to fix something, we got to understand exactly what's broken here. So most business owners are unaware that when they own their own health insurance contract, they are actually running a mini health insurance company inside of their own business. Now, what do I mean by this? Well, I put these two cars crashing to make an example of this. Let's just say next month you decide you're going to give all of your people money to buy or to help with their car insurance premiums in the marketplace. So you're going to give them a certain amount each month, and obviously they can get their own coverage in the marketplace. But if a broker sold you this plan, a car insurance plan, and then all of a sudden at the end of the year, they said, hey, your 40 employees, you actually had about like 4 to 6 of them actually had DUIs, cracked up their cars, speeding tickets and everything else. And all of your 40 employees' rates are going up all at once. Now, I would hope that you'd understand or think to yourself, that's little more than wrong, because basically health insurance companies over decades now have formed a system and wanted you to buy into this system that has you own it, and all of the claims of your 40 employees or however many you have, all the claims will determine whether or not your rates go up next year. And when they go up, you usually raise your deductibles, raise your out-of-pockets. Most people are aware of this nonsense, okay? But this has been going on for decades, and we're here to stop that right here and now. So first of all, do you really want another business to manage inside your business? When your business owns the health insurance companies dictate future premium pricing for all employees, like I said. The collective insurance claims comes back to your broker, and all of those employees' claims are calculated into your increased premiums you pay at year end. But here's the most important point, that bottom bullet point. By actually owning the traditional insurance contract, you are locking out your employees from receiving discounts, and most times substantial discounts, by buying their own coverage in the marketplace. I'll show you what I mean in a sec. So I'm going to take you on a little journey of what it looks like to set up and run a traditional group healthcare system. Year one, the costs are high right away. In fact, it usually becomes the second or third largest line item on a company's P&L. Second year comes. The system continues. A few of your employees have bad claims, and all employees' rates go up all at once. Your broker delivers your renewal in year two. Your health insurance costs are going up 6%. But then comes year three, and the system, your mini health insurance plan, explodes. One employee has cancer. Another employee is in the hospital on dialysis because of his diabetes, and another employee just had a premature baby, and the baby is in the hospital under 24/7 care. Those claims, by the way, are $1 million claims on average. But here's what happens. Your broker comes back and delivers your healthcare renewal. It's going up 27%. Now, if you're a company of just 40 employees, you're spending on average about $600,000 for those 40 employees. A 27% renewal means just next year, your premiums are going up over $160,000 in 1 year. Now, if you weren't on that system and the employees own their own coverage and the claims were paid by the health insurance companies, that could never happen, could it? So most are asking, why can't employees own their own coverage? They can, actually. And now employers can reimburse their employees, and many times tax-free. There was an actual law that was passed back in January 1st of 2020 that allows employers to basically be money providers now, giving their employees the dignity and choice choice in the marketplace to buy their own stuff and then reimburse them however they see fit. But why don't more brokers offer this alternative? Well, if you think about this, it's relatively simple. It's way easier to sell a business one insurance contract, deliver that contract, roll it out in the traditional way, claims or no claims. It's just easier to sell that one contract than it is to customize health insurance for every single one of your employees and their families. That's a huge amount of work. Most are not staffed up to handle that, but that is a lot of work. And most times around the United States, back to that 40-person group that had a 27% increase, if it went up from $560,000 up to $725,000, most brokers around the United States get paid a percentage of the premium. So if you were one of those unlucky employers out there that had this huge increase, guess what? Your broker just got a raise and you probably weren't even aware of it. So if individuals could buy their own coverage in the marketplace, I was curious as to how popular these products were. So I went back the last 5 years and I found out that in 2020, there was 11.4 million people on the individual health insurance enrollments across America. That has now grown to 21.3 million. Almost 10 million more people are on individual coverage as of 2024. And another product that's not that well known is called health sharing. I went back the last 5 years and found out that the health sharing enrollments across America was 2 million people on health sharing in 2020, and that has grown 75% higher to 3.5 million in 2024. Now, health sharing is something that's not quite as well known, but let me take this a little step further and educate you a little bit about what health sharing is all about. Health sharing has been around for 30 years, believe it or not, but now it's come into the employer marketplace in the last 10 years. This is an example of coverage of one of my health sharing companies, and this happens to be the most expensive one in the marketplace. This is an example of a $1,500 initial unshareable amount, or IUA, which is similar to a deductible on health insurance, and these are the different age groups, under 30 and over 30. If you look at the over 30 prices for a member only, it's $233 a month. If you look at a family, it's $698 a month. Now, when we look at the trends in group traditional health insurance coverage, the average employee cost is $700 across America right now, and the average family is just under $2,000 a month. So when you look at the individual marketplace, there are choices. There's individual health insurance and there's health sharing. We'll go through that a little further, but let's get back to the cafeteria plan. So let's take a look at inside the system and outside the system with the cafeteria plan. I want to just point out a few things here. Inside the system, this is an example of a company paying 100% of the employees' premiums. These are the listing of a 60-year-old guy, a single mom with 2 kids, and a family of 5. And their incomes are listed here. I'll come back to that in a second. But here's the group insurance total premiums on a $3,000 Blue Cross Blue Shield deductible, $9,000 out-of-pocket max for a single, $18,000 out-of-pocket max for a family. And here's the premiums that you would be looking at for that traditional group plan. $900 a month for this 60-year-old guy that's working for you. He pays nothing because you're paying the entire amount for employee. Here's a 29-year-old gal with 2 kids. Her premium is $1,600. You're paying her premium of $500, but she's paying $1,100 a month out of her payroll check. And here's a family of 5 making $125,000 of income. They're paying $2,700 a month, of which you pay $700 to the 40-year-old guy that's your employee, and they pay $2,000 a month through their payroll deductions. Now let's go outside the system for a second. Well, here's how the cafeteria plan looks outside the system. Individual insurance can be bought on the retail market anywhere in the United States. It just so happens in my state of Minnesota, it's slightly less than it is on a group insurance plan, about 20% less. So here's what the single guy would be paying, a 60-year-old guy, $664 a month. Single mom with 2 kids, $1,208, and $2,342 a month for that family of 5. Now here's an extremely important point that I want you to look at. On the very bottom, it says, by law, individual health insurance applicants can't pay more than 8.5% of their household incomes for their insurance in 2024. By you offering a traditional plan that you see at the top part of the screen inside the system, it actually locks your employees out from getting the discounts that I'm going to show you in the middle column here. I'm pointing you to this individual insurance discount prices through the exchanges. There are exchanges set up in all 50 states now. They've been set up for the last 10 years. They're working very well, and if you're you're connected to the people who know how to enroll these people quickly and efficiently, we actually can do it online now. Technology is changing everything for the better. But that same single guy with a $50,000 income is going to pay $295 a month instead of $900 a month. Your single mom with 2 kids will pay $378 instead of $1,600, and your family of 5 will pay $776 instead of $2,700 a month. Now, when you look at this, remember, this Blue Cross Blue Shield deductible that you had up here on your group plan is the same deductible, the same out-of-pocket max on the individual marketplace, and who wouldn't want a plan for $295 instead of $664, $378 rather than $1,208, $776? My goodness, that's like 80% less than the $2,700 a month, or even the $2,342 on the individual. But the bottom portion is one of the most unique things in the marketplace right now. My wife and I were on health sharing since 2018 all the way to 2023. Our deductible and our premiums on our group plan were going up. We had a $4,000 deductible. It was $1,800 a month. It was going up to $2,000 a month. We were able to get a health sharing plan in the marketplace for $344 a month for the two of us for a $500 out-of-pocket max. Now think of that for a second. How different is that than insurance in general in the marketplace? Now there are some drawbacks to health sharing, and one of them is there is pre-existing condition requirements or a medical consideration where you need to check off certain things to make sure that you don't have any big pre-existing conditions. Heart attacks, strokes, cancers, all the other things have to go into this decision. My wife and I were able to qualify that pretty easily. Again, pre-existing requirements are in there, but there's also a completely open network. They can go wherever they want in the world. And obviously with your group insurance plan or any plan, Blue Cross, Cigna, Aetna, whatever it might be, there are networks. Most people understand that. But you can go anywhere you want because it's an open network with individual health sharing. The Cafeteria plan allows them to choose either the retail price if they're making too much money, the discount price through the exchanges. Either one of those two, there's absolutely no health questions asked whatsoever. And by the way, when you're on an individual plan, whether it's health sharing, health insurance, and you're worried about if I was an employee of yours and I had a $1 million claim, by law, if I own Blue Cross Blue Shield, by law, when it comes to the end of the year, they can't single me out and raise my premiums 1 penny because I had a $1 million claim. I know that seems a little bit weird, but that's the way the law is set up right now. So what's it like transitioning to the Cafeteria plan? I'm illustrating here an employer group of 40 employees, like I spoke of before. This traditional group spends $600,000 in total premiums, of which the employer pays $400,000 and the employees pay $200,000 out of their payroll checks. Our goal is to reduce down this $600,000 as reasonably as we can, and you saw previously what the individual prices are on individual insurance compared to group insurance, but in this particular case, we bring the premiums down almost 60% from $600,000 down to $250,000. Now, in this particular case, the employer is spending $400,000. If they agree to pay the same amount as they did before, understanding that it's a guaranteed flat budget going forward, this employer can decide at their discretion to pay all the premiums on behalf of the employees. And by the way, you don't have to do this, but you could pay the premiums for both your employees, the spouse, and dependents as well. Remember, that encompassed all of that. So in this case, they're paying all the premiums. But then they have this windfall of $150,000 here. What do employers choose to do with that windfall? Well, obviously, they could pay bonuses to their employees. They could give their employees raises. They could raise their match on their 401k if they wanted to. But in this particular case, this employer wanted to offer a zero premium, zero deductible plan for all of their employees and make the most dramatic transition or transformation of their traditional group plan into something that the employees truly appreciated. So in this particular case, we can offer the employer to take that $150,000 and drop $3,000 into all of the employees' HSAs. Remember, an HSA is something that if not used 1 year, it converts to the next year and to the next year. So, but in this particular case, when this employer drops $3,000 into everybody's HSAs, we have an HSA provider that puts your employer name on the swipe card for your employees. So when they go in for prescription drugs, ear infections, broken ankles, whatever they might need it for, you are actually providing them with $3,000 in the first year, which you could continue in subsequent years. But in this particular case, first year transition, $3,000 on everybody's swipe card with your employer name on it. What you end up with in this case is a zero premium, zero deductible, guaranteed flat budget for your business. Now, we like to use only individual health insurance in transition. Why? Because there's no health questions questions that are asked of your employees. And even though we have health sharing on the menu, we don't really stress that so much because we find that it causes a little more confusion. People may not be familiar with what health sharing is. And so we like the transition to be smooth for what employees understand. That health sharing will still be on the menu in subsequent years that employees can choose at open enrollment, but it's not something we stress right away. But let's talk about the features of the cafeteria plan all in all. So at the end of the day, what we're advocating for here is to disconnect from the actual overall health of your employees, because those claims and the overall health of those employees is going to kill you in future years, and it's really not even sustainable. But you're free from the rules and regulations that keep driving up your costs. Businesses have 100% set budgets that they control. Employees design and choose health insurance or health sharing. Again, that's their choice. They don't have to go with health sharing. They don't have to go with health insurance, but you're giving them a choice and you're reimbursing them in the best way possible. Big savings for both you and employees, and the business leverage their reimbursed dollars in the best way possible. But the biggest thing for me, in 28 years I was delivering these renewals to my clients, the business never ever has another healthcare renewal ever again. You don't have a broker that can ever come back to you and say, hey, your 40 employees' claims were bad. It's going up 5, 15, 25%. That can never happen under this. It's a guaranteed flat budget. The cafeteria plan system that I set up has taken 4.5 years to set this whole thing. But there's basically 5 elements to it. First of all is a design which is customized based on what you want to do. You want to open the doors for those exchange discounts to your employees. We design it a certain way. You want to put health sharing on there. We design it a certain way. Everything comes down to design at the beginning. The second part is a very, very critical thing. You need education on both your HR teams, and they all have a dashboard to use on their own, and the employees and what their choices are in the marketplace. So every one of these plans takes 90 days to convert from a traditional plan to a cafeteria plan, but we take care of the education on the front end. Enrollments. This is another thing where technology has just caught up dramatically. Online applications is available both on the health insurance and the health sharing, which basically your employees just go onto a screen with the help of our administrator and our enrollment team to where they basically help them choose. It only has to be done one time a year that they choose this. So if this sounds a little overwhelming, keep that in mind. Once a year. That's the only amount of times that your employees need to choose this. You will set the budget. You will give them money, either tax-free or after tax, and they will choose how to use that in the best way possible. The administrator. Administrator number 4 is a really key thing. Over the last 3 or 4 years, there's been administrators around the nation, and the best ones provide electronic premium deliveries for all of your employees. So you basically pay your administrator one check each month. They split that up with all 40 employees, and whether they're insured by Blue Cross, Cigna, Aetna, United, it doesn't really matter. They provide those premium deliveries directly electronically to the carriers in all 50 states now. And the last part is the compliance. It's very, very important. You want to be compliant with all the laws of how to do this, but we vet every plan designed for every employer. So the cafeteria plan is a coordinated system that works kind of in concert together. All of these HR, the administrator, the enrollment team, the health sharing team, the compliance team, all works in concert on your behalf. And when I thought this thing through, I thought, okay, the last thing a company wants is to be left alone to try to figure anything out on their own on this thing. That is a lot of what I just brought up to you. But we provide a quarterback for every single company that wants to convert to the cafeteria plan. So it's really a managed and done for you program. At the end of it all, we think health insurance should stop crippling any business out there. The cafeteria plan allows you to focus on what you've always wanted to focus on for years, your business. You provide the money for your employees. They use it to the best of their ability with our team, and you go on with your business. Thanks so much for joining me here today. It's been my pleasure.